Hello. So for my analysis paper, I was able to find some articles and research about amnio infusions. And so an amnio infusion is when a provider inserts a internal uterine pressure catheter, and then that is used to monitor the strength of contractions more accurately, and then also because it is a catheter, fluids such as usually lactated ringers are also infused into the uterus, and this is mainly used to treat cord compression or low amniotic fluid. And so this happens usually after the water breaks, and that loss of fluid in the uterus makes the fetus less buoyant, and it can cause compression on the umbilical cord, and so the fetal heart rate is more likely to drop and have variable decelerations or other decelerations, and this is not good because the fetus is not getting enough oxygen to itself and its tissues, and so it is really important to correct these variable decelerations and to help regulate the fetal heart rate back to normal. And so the lactated ringers are infused or inserted into the uterus to help make it more buoyant. And I wanted to research this because my first clinical shift, when I was on the labor and delivery unit, we had a patient that came in for her first pregnancy, first birth, and her water had broken the night before, and she had been admitted the night before. So she had been at the hospital for several hours at this point, and while we were monitoring her baby, there were some variable decelerations and just not a lot of variability and other things that were a little concerning to the nurse. And the provider had already placed the internal uterine pressure catheter as well as a fetal scalp electrode to monitor everything with the contractions and the fetal heart rate. And so we had accurate readings of those, and the nurse was just a little concerned that those were showing signs of stress and just a little bit of overall that the fetus wasn't doing as well as it should be. So we went in and started a bag of lactated ringers to be infused into the uterus, and we watched the fetal heart rate after this, and there was improvement. And the reason that I was wanting to research about this is because my nurse made a comment that she wasn't sure if it really the amnio infusion was going to help, or how much of the improvement was due to the amnio infusion. So I was curious about what amnio infusions are specifically indicated for, what they're not indicated for, and how helpful they actually are in improving the fetal heart rate and overall outcome of the newborn. And so through my research with from these two articles, one focused on I think there was 200 participants in this study, and it showed that there was an increase in better outcomes for newborns when the amnio infusion was performed, and they had better pH levels drawn from the cord after birth, and better APGAR scores at the 1 minute and the 5 minute as well. So overall, just better outcomes for the newborns, and honestly, just successful in the treatment. There were no reports about pain or discomfort during these treatments, so pretty low risk and well tolerated by the mothers in these studies. They did just report feeling lots of stuff leaking out because the membranes are broken. So the fluid that you're putting in is eventually just gonna come out too. But no pain or discomfort during the infusions. And then the other report talked about 2 specific case studies, and these case studies were more focused on fetal growth restriction and preterm premature rupture of membranes. And so these women both were around 30 weeks gestation, and their water broke, and so they came in to help prolong their pregnancies and stop their premature labor. And so the amnio infusions in those cases were not specifically for cord compression, although they did have signs of cord compression after their water prematurely broke. And in these cases, both women received at least 1 amnio infusion, and it helped prolong their pregnancy up until about 32 weeks, 31 and 32 weeks, and it helped the newborn outcomes as well. So both babies had relatively good APGAR scores, and they both needed to be hospitalized in the NICU, but were relatively fine a week or so after and were able to go home. I also just learned about how this is not indicated if the mom has any type of infection in the uterus, and also if they have very imminent distress signs and the baby needs to be born like right away to help save that. The amnio infusion takes a while to get all set up, and you have to insert the catheter as well, and so it can help prolong the pregnancy and help with those variable decelerations. But if the baby is in immediate danger, then this is not an option, and the baby should just be delivered via one route. And I think what my nurse did was for the best. It was a good decision because there were signs of variable decelerations and cord compression, and so the amnio infusion, especially because it doesn't hurt the mother at all and it can help the fetus, I think it was a good choice to go ahead and do the amnio infusion. And whether or not the improvement in the fetal heart rate was directly from that or not, I think it was worth trying every intervention to help and improve the outcome for the newborn and the mother. So I'm grateful that I was able to do this assignment and learn more about amnio infusions.